Hey guys, I'm Brooklynn, one of the nurse practitioners here at Midstate, and today we're going to kind of dive into the most common types of questions we get here in dermatology. Alright, so when you're wondering if a mole on your body is something you should be concerned about, we always say to go by the ABCDE rule. What that means is you're going to look at a spot on your body that you think could be concerning, and you're going to see if it meets any of these features. A stands for asymmetrical. Is it even or is it irregular throughout? B is going to stand for border irregularity. So if it is, circle on one side and then kind of not even on the other side, it doesn't have a nice smooth border. C is going to be for color, so any color changes that you've noticed throughout the years. D would be diameter, so if it's any bigger than a pencil eraser. And then E would be for evolution or changes over time. If any of those occur, we always say it's best to come in, have it taken a look at, and let us tell you if it's something you should be worried about. Another tip is if anything's ever symptomatic, so itchy, burning, stinging, bleeding, wounds that won't heal, that would be also something we would want to know. All right, so breakouts as an adult can be common, and it's not always just puberty or acne. There are a lot of things that can influence breakouts as we become adults, and that could be anything as simple as hormonal fluctuations, whether that's pregnancy, menopause, or other hormonal changes you're going through. Sometimes it can also be stress related, and it can also be caused by certain medications. We also have these autoimmune conditions that can kind of come into play at any time in our life, and that could be rosacea, perioral dermatitis, seborrheic dermatitis, different things that kind of flare throughout areas of stress. So the question of how often you should wear sunscreen is very important. It should be every day. Even if you're thinking that you're going to be inside all day, there are still UV rays that can come in through our windows. So just getting into the habit of doing a tinted SPF moisturizer or non-tinted will kind of lead to better results and being covered all the time. Another tip is most people forget tips of your ears and the top of your hands and your nose. Those are all important areas to make sure you have covered. Okay, so having a skin check can really be at any time. There's no certain number that you have to be. But typically we would say anybody over the age of 30, anybody that has had prolonged sun exposure with their career, jobs, or fun, anybody with a strong family history of skin cancer, if you have any autoimmune conditions or any other types of cancers, those would all be reasons to come in and start getting skin checks. While there's many things I would never do to my skin as a provider, one of the most important things I believe is picking. Refrain from picking itchy spots, bug bites, scabs, acne bumps, anything like that, because it can lead to skin damage of the tissue and leading to breakdown and scars that can sometimes be irreversible. Yes, it is bad to pick your pimples. A lot of us are guilty of it. But what that does is it can introduce bacteria from our fingers into our pores, and that can lead to inflammation, worsening of acne, superficial bacterial infections, impetigo, and delayed wound healing. Yes, absolutely, diet can have an effect on our skin, both good and bad. So having a diet full of vitamins, minerals, and antioxidants can lead to delayed aging and then also healthy skin. Whereas the adverse effect, if you have an unhealthy diet, including refined sugars, processed foods, excessive alcohol, that can always lead to inflammation of the skin and then also aging of the skin. Okay, so aside from regular things such as like acne, rashes, eczema, when you're thinking about if you should get a skin check for your child, you would want to think, do they have any regular large birthmarks? If so, those are always something that we should monitor for any changes. Or if you have a strong family history of melanoma, that would also be a thing to bring them in sooner than later. And then any like increased sunburns or excessive sun exposure. Yes, skin cancer can have a genetic factor to it and not only environmental. So there are certain gene mutations that we can have that lead us to an increased risk of skin cancer. Also, melanoma, of course, is one of the biggest ones that can definitely be a genetic component to that. Also, as we get older, the gene mutations and breakdown of our skin cells increase, and that puts us at a greater risk as well. right, so most people will come in and they ask us, what is these goosebumps or this chicken skin that I have on our arms? And they think that there's something wrong with them. It is one of the most common things that we get in adolescents that come to see us. It is a benign condition that exists in about 50 to 70% of the population, mostly in the winter months. And it is a condition that we nickname KP, or keratosis pilaris. And all that is meaning is like scaly, flaky skin around our hair follicles. It's thought to be a barrier dysfunction in the skin, and while there's no great treatment for it, most of it will self-resolve when people get into their mid-20s. Things that you can do over the counter would be good exfoliating, certain creams that have salicylic acid, and then sometimes a topical retinoid.